really appreciate each of you arranging for us to just update the group about research. I just wanted to start by saying that this is one of the few, for those of you who don't already know, one of the few large cities in America where all three movement disorder programs actually work together on the research. And, I think a big draw for me moving here from University of Utah was the opportunity to try to fill Dr. Shill's role here at the Institute when she took her current position, but also to work together with her current group and Dr. Mehta's group at the Mayo Clinic on clinical research. So maybe I'll just preface by explaining what the basic types of research that are going on in the field of Parkinson's are, and just give a couple of quick examples. I think we had planned about 10 minutes for each of us just to give brief overviews and a lot of time in between for questions. Yeah. I understand, right? We have quite a few people joining that will have a lot of questions.
Oh, we do have. I'm looking and we've just got people joining by the thousands.
Yeah. So first of all, just to explain, when people read about research in Parkinson's, a lot of times people hear about preclinical research. And what that means is that's research that's still happening in a laboratory. And that can be in a test tube or with animals that have something that looks like Parkinson's. But the majority of what we're talking about today is more clinical research. That research mainly involves people with the condition, in this case, Parkinson's. But it also doesn't necessarily mean we're talking about studies on medications or drug studies where people have a drug or a device or a procedure tested on them, but it can just be observational research. And one of the main examples of observational research is our brain and body donation program that all three of our groups work together on. That is a program where we see patients with Parkinson's, Alzheimer's, Lewy body dementia, or healthy older individuals once a year. And all of our neurologists are involved to do both exams testing memory and thinking, but also movement disorder exams. And there are a number of other tests we use so that for people who do donate when they pass away, we have all this information we've collected about them. Almost 500 papers have been published around the world using all the information that was gathered from that type of study. And my colleagues can share with you some of the important findings. They were directly involved in publishing a lot of those studies. The new kid on the block with that. The other important type of research is the clinical trial research. And that's where we're testing a drug, a medication, could just be a supplement, or a device like the deep brain stimulation devices, or even a procedure, just like physical therapy. Because of that kind of research, we have a lot of new medications that have become available for Parkinson's in the past 20 years. In fact, there are a couple of new medicines that just became available very recently, not just for the movement disorder problems, but for what we call the non-motor problems. So we have a new therapy, first ever approved therapy for hallucinations of Parkinson's called Nuplacid. That was just approved last year. And just in the last couple of years, we had a new therapy for people who have low blood pressure standing up, what we call orthostatic hypotension. That's called Northera. That was just approved in the last 3 years. So new medications have recently been developed because of those studies. 80% of clinical trials do not recruit patients in a time frame that we had aimed for. And so they recruit behind, and because of that, the research takes a lot longer than expected. So it's very important that clinical research has enough patients to participate in the study, otherwise it won't be successful. And that's why all three of our groups are involved in clinical trials, not just the observational research, but the ones where we're testing new therapies. We generally don't get involved in a study unless we feel like it's going to make a difference beyond what's currently available. So there are some studies we choose not to get involved with if we don't think it's practical to do this study, or we don't think we're going to be able to find the patients, or if we're not really sure it's going to make a difference for patients. It looks like it's only going to make a difference for the kind of bottom line of the stockholders at the company involved. So that's my kind of my basic summary of the types of studies. I'd say just to highlight one really important area of research that's a little bit more of our focus in Sun City at our institute is trying to find better treatments specifically for non-motor symptoms of Parkinson's, particularly the memory loss issues, but we're also going to be involved in new therapies, trying to address the need for better therapies that improve the REM sleep behavior disorder, where people can act out their dreams and may hurt themselves or others. Those are two trials that are pretty unique to our center, studying Parkinson's disease, dementia, and REM sleep behavior disorder in Parkinson's. So I'll open up for questions because I know you've got lots of people calling in and have, I'm sure they have really good questions.
Thank you, Dr. Shprecher. I just want to remind people, those of you who may come in late, that at the bottom of your screen, there is a chat icon. And if you click on that, you can type in your questions. And I will then read them to Dr. Shprecher. You have the capability of sending private chats or sending chats to everyone. So if you want to send in some questions, you know, please do it at any time with anybody speaking, and then we'll ask them as we have opportunities. So, and I see that Dr. Shill has joined us, right? And so she will be a part of our discussion too. Dr. Shprecher, you know, you had talked about research for restless leg syndrome. Tell me a little bit more about that. Tell us more about it, because restless leg syndrome seems to be such a common pre-diagnosis condition, and then it affects so many people with PD.
Yeah, and maybe I'll just clarify. There are several sleep problems in Parkinson's, ranging from insomnia and sleep fragmentation to restless leg syndrome. The condition that I mentioned earlier is called REM sleep behavior disorder. It's often confused with restless leg syndrome. What it is, it's a condition where instead of just the eyes moving during REM stage, rapid eye movement stage of sleep, other muscles of the body move when they're not supposed to. And so a person will actually act out a dream. And often it's a violent dream where they may hit or kick, even jump out of the bed. And that's where the patient, this bed partner, even the pets can be harmed by that violent dream enactment. That's something that may occur many years before a person is diagnosed, and they don't realize that it's related. But long-term studies suggest that while it may take many years, most people who develop this condition late in life will eventually develop either Parkinson's or a related condition like Lewy body dementia. But we still don't understand why, and that's another reason why we're enrolling people who just act out their dreams in the brain and body donation program. There are some therapies that doctors prescribe to try to reduce this, but we will be involved in a study trying to test a new therapy to see if it's effective in reducing that problem. Now, restless leg, just to clarify, is a condition that about 5 or 10% of the population has to some degree. It may get worse during pregnancy or following blood loss because of reduced iron storage in the bloodstream. And many people with Parkinson's disease note that it either develops or worsens when they're treated for the Parkinson's. In particular, for a lot of patients, that restless feeling happens when their medicines wear off during the night. So adjusting the medicines to have a bedtime dose or a longer acting preparation may actually reduce that restlessness. So really important to bring up all those sleep problems to your treating physician if they come up.
Okay, and how would people reach you if they wanted to be a part of your research studies?
Yeah, I think the best way, so each of our websites, each of us has a website that I think on your website, Judy, the Movement Disorder Alliance has links to each of our websites where we will update the list of currently recruiting clinical trials so people can find more information about the trials and know who to contact.
Okay, so they can come through our website as well as directly then to
Yeah. Yeah, that way, you know, if it's all on your website, which I know it is, people, you know, kind of do one-stop shopping there.
Okay, and then I had a question that perhaps you can answer, and then we'll go on to our second speaker. How is a participant notified about trial outcomes?
Yes, so once a study is completed, if it's a, say, a medication study, the sponsor will usually have a press release, and you know, the initial findings would be made public.
Okay.
The individuals don't always find out right away whether they were taking a real active treatment or a placebo if they're in one of those studies where there could be an inactive treatment called a placebo. But most studies do commit to eventually providing that information once that's approved by the sponsoring company or other government agency.
Okay, thank you. Well, I know we have some more questions, and what I'm hoping is we can roll through each of you speaking about your individual research projects and then come back to some of these questions and put it to all three doctors. So next up, Dr. Shill, are you there?
Hello?
Oh,
can you hear me okay?
Okay, I can hear you okay. And we just kind of switched up the order. Dr. Shprecher started before you came on. So it's, we're really happy to have you. As I mentioned in the beginning, Dr. Holly Shill is the director of the Muhammad Ali Parkinson's Center's Movement Disorder Program. And we would love to hear what you're doing there in terms of research.
Right. So first, thank you for having me. I'm really excited that we're doing this type of thing. So, and I'm sorry I don't have a video for you all to see me here sitting in my office, but that is where I am right now. So I thought I would share with you just some of I know Dr. Shprecher just talked about kind of the types of trials. I'd share with you a little bit about some of the studies that we are doing. There probably is going to be some overlap with the studies we're doing here because they're often done in multiple locations. So Sun City and Mayo are also likely to be doing some of these studies. But I thought I would just kind of talk about them. So first of all, one of the kind of big ideas is just the types of studies that are ongoing in Parkinson's disease. So Dr. Shprecher talked about observational studies, and then we also have early Parkinson's disease studies, and then we have more advanced Parkinson's disease studies. The types of studies that we don't really have a lot going on right now are people kind of in the mid phase, and that's mainly because most of our drugs are fairly effective during during the early and middle phases of Parkinson's. So people will often ask me if they have been diagnosed 5 years or something, is there a study for me? And there usually isn't a treatment study for that type of person unless they're having some other types of symptoms, and that's because most of our drugs work reasonably well during that phase. So the big focuses really are on early Parkinson's, where we are trying to slow progression, so things that we can start at the beginning of Parkinson's and show that they slow progression, or with more advanced Parkinson's, where some of the treatments are actually starting to fail and not work as well. So let me just go through a few of these. First of all, in early Parkinson's disease, we are part of the SURE-PD study, which is inosine to slow progression. That is a study from the Parkinson's Study Group. And that is really looking for people who are newly diagnosed. And the rationale behind this study is that people who have gout or high levels of uric acid in the body tend to actually have less risk for Parkinson's disease, and then if they do have Parkinson's disease, they tend to have slower progression. So the idea is can we intervene and actually raise this chemical, this uric acid in the body, and actually slow progression. So that's that study. And then we are also going to be looking at, we just started looking at a new type of dopamine therapy, one that works differently than anything else on the market. And so that's a novel treatment, and we're looking at that actually both in early Parkinson's as well as those who have more advanced with what are called motor fluctuations. I'll get to that in a minute. And then finally, we are getting into the phase now of these vaccine studies. I think some of you probably know about these types of studies, but there are a number of companies now developing basically what amounts to vaccines for Parkinson's. So we know this protein, alpha-synuclein, that accumulates in Parkinson's and is associated with the progression of the disease. And so the idea is you actually immunize people against it, and that helps the body actually break down that particular protein, actually form an immune response to it, and hopefully reduce some of the progression. So, and I think there are at least 4 or 5 companies worldwide that have developed antibodies, are now getting into clinical testing with them. So we for sure will be doing one of those studies, working with one of those companies, and then there's a potential for working with a second company. So, and that will also be in relatively early Parkinson's disease, so people, fairly newly diagnosed. And the reason we study these things in early PD is it's just a simpler way to study a therapy. You actually need fewer patients enrolled in order to see if a particular therapy works. So people often say, well, why can't I participate? I've had Parkinson's for 5 years. Why can't I participate? And the idea is really actually to get the therapies to the market a little quicker by studying them more efficiently. So these vaccines, by the way, are not something that are going to be used just preventatively. I mean, the idea is that you could potentially use them at any stage of Parkinson's to help to slow progression. So that's an exciting thing, kind of a novel thing that really hasn't been tested in any great detail. So the next group of therapies are really dealing with these motor fluctuations. So the on-off behavior. So people who levodopa, their dopamine medication kicks in really well, but then wears off quickly, and then so they have multiple periods of off periods per day. There's a big interest in therapies for this because this is a major reason why people go on to deep brain surgery. So the idea is there something that we can do either prior to brain surgery or instead of brain surgery that may keep people from needing to have surgery in the first place. So and we have, I just counted 1, 2, 3, 4, 5 different studies looking at motor fluctuations. So ranging from a pill per day to a pill several times per day, up through sublingual medications that are used as sort of a rescue medication. And then we also have an infusion pump that administers medication continuously through the day. So, and it's a variety of different types of approaches to dealing with motor fluctuations. So maybe someone with very mild motor fluctuations may opt for something like a pill research, where it's just an additive pill once a day, versus somebody who has a much more complicated picture, very, significant fluctuations, lots of wearing off through the day, might consider one of our infusion studies. So, so just kind of an idea there on what we're doing. Let's see, we are also doing some observational studies. We have an interesting grant from the Michael J. Fox Foundation to actually look at improving recruitment into clinical trials. So a number of interventions that we're going to be implementing, sort of these novel interventions to try to make people more aware of some of the research that's being done and that type of thing. So, and we'll look to see if that actually makes a difference on people's kind of interest and willingness to participate in research. So we are part of the National Parkinson'S Foundation. We're a center of excellence. So we have an ongoing longitudinal study looking at outcomes, how people do with Parkinson's. So that's kind of an interesting study. Lots of good information. We have over, about 250 people currently enrolled in that. And then we are doing research in why people fall with Parkinson's disease. So we have actually a couple studies looking at fall prevention in folks with Parkinson's. So one is a drug that I think Dr. Shprecher talked about that affects blood pressure in Parkinson's, but there's some thought that it actually may reduce fall risk as well. So in fact, we pretty seriously believe that it does reduce fall risk outside of the effect on blood pressure. So we're looking at that in the study. And then we're also looking at falls in people with cognitive impairment. So not only Parkinson's, but also looking at falls in Alzheimer's disease. So people who have cognitive impairment in addition to Parkinson's disease and have been having falls, we're looking at a specific therapy for that. So, and I think that's about summarizing everything that's going on. So a lot of different things going on. So, and I think I'll kind of pause there and see if people have questions about what we're doing.
Okay, well, thank you so much. You've got a lot going on, and it sounds like there's some cross-pollination with some of these ideas about research as far as working with Alzheimer's. I know I've seen in some of the Alzheimer's literature that researchers into PD and researchers into Alzheimer's are reaching across the aisle to each other. Do you find that's the case?
Yes, so right. So for instance, a drug that I was just talking about that reduced fall risk, it actually came out of studies being done in Alzheimer's disease, where they were seeing that there was about a 2/3 reduction in falls in the people in the study for Alzheimer's. So they were trying to treat cognitive impairment, trying to treat the memory problem. And they were just looking at side effects of the therapy, and they were seeing this dramatic reduction in falls in the Alzheimer's population. So logically, you would say, okay, well let's actually look at this specifically. So and take a group of people that are at higher risk for falls in the Parkinson's community and see if the drug might work there. So yeah, it's an interesting thing, and I think Dr. Shprecher, I know they've been looking at a study that. Specifically for cognitive issues in Parkinson's. And I think we'll be seeing more of that. I mean, most of the memory medications we use, in fact, all of the memory medications we use in the clinic came from Alzheimer's disease. And now we're just, essentially trying them and seeing how they work in Parkinson's. But we're really seeing more of a push too to actually specifically address Parkinson's cognitive issues separately.
Okay, well, thank you for that. That's good to know that scientists are working together. I was going to suggest, Dr. Mehta, that we move to you as a movement disorder at Mayo Clinic in Scottsdale, and you share with us your information, and then we'll just throw it open for some questions to all three of you. So, Dr. Mehta?
Sounds good. Thank you. Thank you, Judy. And I wanted to thank PMD Alliance for organizing this and, giving me an opportunity to, with me being in my office, an opportunity to interface with other physicians and so many people who are participating in this call. So thank you for this opportunity. I think I just would like to take a minute to underscore the point that Dr. Shprecher made. I think one of the most phenomenal things about being involved in Parkinson's disease and working in Phoenix is the collaborative nature of all the movement disorder, the big movement disorder groups here in the Phoenix Scottsdale area. So because of which I feel really I feel very happy to be a part of this collaborative group with Dr. Shill, Dr. Shprecher at Banner Sun Health. So, we are all kind of working together to try and solve some of these dilemmas and problems that we all encounter in Parkinson's disease. So, I would like to reinforce what Dr. Shprecher said about please take a look at the website and enroll in the Brain and Body Donation Program, because even though that's a longitudinal observational study, as David mentioned, that, so many good things have come out of that program, and we all participate in it. Dr. Shill does, Dr. Shprecher and myself, along with some of the other senior movement disorder neurologists who've been instrumental in starting this program. So a lot of good information has come out of it. So I want to reinforce that point, that please take a look at the website, call, and please participate in that program. I'm going to just change gears a little bit, and I'm going to talk about the research that we at Mayo Clinic are actively engaged in. And as Dr. Shill said, there's definitely some overlap that, some of the studies that we're doing, Dr. Shill or Dr. Shprecher are also doing as well, like the SURE-PD3 study. So Dr. Shill, if you're still on the line, I've completed recruitment for that. So I'd be happy to, if you're still recruiting, because I do see some of those patients. So I'd be happy to refer them your way if you're interested. So just let me know. Also, so I'm just going to take the next few minutes to talk about the studies that we're actively recruiting for, and that would love for patients or subjects to call us, and we'd be happy to see if they meet criteria, whatnot. So one of the kind of a little bit different and an interesting study, at least from our standpoint, is we're looking at weight loss in Parkinson's disease and the potential for small bowel bacterial overgrowth. So the purpose of this study is to examine the factors that may be contributing to the development of weight loss in persons with Parkinson's disease. And it involves, and we'll obviously give more information if there are people who think that they may be eligible. So we are looking at any Parkinson's patient subject who has at least a 10% loss of weight since their diagnosis. So it's a fairly broad criteria. And then, if somebody out there is interested, please give us a call. The coordinator's name is Amy Duffy. And, Judy, you can put this up on the website or whatever if you like, or people can note it down. The phone number, the contact number is 480-301-4750. So 480-301-4750. So this is for a weight loss in Parkinson's disease patients, 10%, at least 10% loss of weight since diagnosis. Another study that we are actively doing and actively recruiting subjects is, this is a study that's been sponsored by Michael J. Fox Foundation, and it's a systemic synuclein sampling study, or called an S4 study. This is again, as Dr. Shprecher and Dr. Shill mentioned, this would fall under the category of an observational study where we're collecting, and again, it's us and about 6 other sites across the country that are collecting sample tissue and fluid, and as a biomarker for Parkinson's disease. So this is a little bit of an invasive study, as we'd be collecting tissue in the form of a salivary gland biopsy, skin biopsy, and even a colon biopsy, and other fluids in the form like a blood sample, a saliva sample, and even a spinal tap. So I understand that some people might have some reservations about the invasive nature of the study, but again, we'd be happy to talk and give more information on a one-on-one basis if anybody's interested. Again, this is the S4 study that's being done through the Michael J. Fox Foundation, and we're still enrolling both early Parkinson's disease patients, that ones who've just been diagnosed and are not on any dopaminergic medications, and also late-stage Parkinson's patients, like who've had the diagnosis for more than 5 years and are having some of the motor fluctuations or dyskinesias, where the motor fluctuations being where the medications doesn't last till it's time for the next dose, whatnot. So, so these are a couple of studies, and another, just changing gears a little bit, some of the industry sponsored, where we work with the pharma industry and try and test out medications. Again, both of these are industry sponsored studies. So One of them is for sleep problems in Parkinson's disease. So it's to evaluate the tolerability of a particular medication. Again, it's just a bunch of alphabets and numbers, but it's for the treatment of excessive sleepiness in subjects with Parkinson's disease. Now we know that, as Dr. Shprecher mentioned earlier, that sleep problems tend to be a huge issue in folks with Parkinson's disease. But among the vast, all the different kinds of sleep problems that folks have, one of them is excessive daytime sleepiness. And, some of this is probably related to the medications that we use to treat some of the symptoms of Parkinson's disease, and they have these side effects as well. So, with this study, again, this one is a short study, and it involves also an appointment with our sleep specialist. So I'm doing it in collaboration with our sleep specialist here at Mayo Clinic. And again, the sleep study and all that would all be done as a part of the study procedure. So obviously none of this would be there would be no cost burden to the patients for any of these tests, whatnot, which is pretty much standard procedure across a lot of the sponsored studies. So again, this would be a medication to treat excessive sleepiness in subjects with Parkinson's disease. This is a short study, about a 5-week study. So, it's unlike many others, which goes on for 6 months or a year. This would be a very short study. So, please, again, call us if you're interested, and we'll be happy to give you more information about this study. And another study that I wanted to highlight was, again, a genetic, this is a study with a drug that is directed towards a fairly specific subset of Parkinson's disease patients. These are patients who have a particular genetic mutation. It's a GBA mutation that, is again, commonly, well, not commonly, but in about 15% of Ashkenazi Jewish Parkinson's disease patients, and about in 3% of Parkinson's disease patients of other ethnic backgrounds or origin. So again, with this, in this study, again, the drug that is going to be tested is, it's called a glucoceramide synthase inhibitor. I know that doesn't mean much to a lot of the patients, folks out there, but so it's a drug that targets a particular enzyme and thereby reduces the formation, or that's the hypothesis, would reduce the formation of Lewy bodies. So again, this is a randomized double blind. So again, it involves a placebo-controlled arm, and this study is going to go for a longer duration. It's about a 52 weeks, so about a year of the blinded phase, where whether they're on the drug or placebo. We wouldn't know that. The patient wouldn't know that. I wouldn't know that. But after that phase of the study is complete, there is an open label extension where everybody who's enrolled in the study would actually get the drug, would actually get the medication. And again, this would be looking for patients with early Parkinson's disease. And they would, if somebody, again, we'd be happy to talk to them, and they will get genetic testing as a part of this study, as a part of the screening procedures of this study. So please, again, feel free to reach out to, me or Amy Duffy, and we'll, help them navigate the system and give you more information about these and other studies that as they come up. I think these are the few studies that I wanted to just kind of highlight, because we are actively recruiting for these. But even besides this, there's a lot of other research that's going on here at Mayo Clinic, and also with us in collaboration with our colleagues, with Dr. Shprecher and Dr. Shill, and as a part of the brain body donation program at the Banner Sun Health Research Institute. So, please, whether you participate with me or anybody else, but I want to encourage our Parkinson's disease community to actively participate in any ongoing research that they may be eligible for, because that's how we learn more about the disease. That's how we're going to hopefully bring about a cure. So thank you.
Thank you, Dr. Mehta. For all three of you now, you can just jump in as you want to with the answers, but we've had a question about what's going on with stem cell research. Can any of you comment on that? Does anybody want to start the conversation? Dr. Shprecher, Dr. Shill, or Dr. Mehta?
I mean, I can take a go at it. So this is Dr. Shill. So first of all, so stem cells have been studied in Parkinson's disease. I mean, it's been, I don't know, almost 3 decades now since they were actually first studied. So back in the early 90s, there was kind of a definitive paper on stem cells in Parkinson's disease, where they were actually using stem cells, in this case using fetal tissue, to basically mimic the effects of dopamine. So they put it into where the dopamine neurons project into. And what they actually found was that, yes, there was some benefits. I mean, people got motor benefit. It was like these stem cells were producing dopamine, and then people were getting motor benefit. So, however, a certain percentage of them, and actually a fairly decent percentage of them, actually got too much dopamine, where they were actually having kind of uncontrolled dopamine-related symptoms, particularly dyskinesia, to the point that several patients, I think it was 5 patients in that study, and it wasn't a very large study, actually had to have a neurosurgical procedure to delete the effect of the stem cells. So, and so based on that, the researchers concluded that, while this was somewhat promising, it certainly wasn't strong enough of a benefit to kind of justify that the side effects were significant enough that they couldn't justify moving forward with that particular therapy. And then furthermore, just some of the ethical issues with using fetal cells. And kind of fast forwarding today, I mean, people continue to look at stem cells, but the problem, at least so far, is it really is hard to address all of the issues with Parkinson's. So where you can get a dopamine effect in the dopamine area of the brain, it doesn't address cognitive issues, it doesn't address bladder issues, constipation. I mean, all of the other kind of symptoms that are associated with Parkinson's. And then furthermore, we know that at least we can't really get stem cells to work unless we actually directly implant them into the part of the brain that we think is dysfunctional. And so the idea to try to find all these different little spots in the brain of people with Parkinson's and put a little stem cell in there really is just kind of hard to do. So I think there's still potential for stem cells. You could potentially use them as sort of providing trophic factors to the brain in kind of a more general way. But then I think the question is where do you put them in order to get that benefit if Parkinson's is indeed more than just dopamine. So I think people are certainly doing research on it, and I'm assuming, and we'll probably continue to see studies on it. But my own impression is we actually have to kind of get back to what's actually causing Parkinson's in the first place, or causing the progression, rather than just trying to replace the cells that are missing. So.
Right. This is Shyamal Mehta from Mayo. And I mean, I agree with everything that Dr. Shill said. And that's kind of what I tell my patients as well, that the Parkinson's is so much more than just dopamine. And, so the cognitive issues and things like that. So sometimes, at least the impression that I get from talking to some of my patients is that we felt that the stem cells was going to be that one answer that was just going to fix everything. And I think we don't feel that way, or at least I don't feel that way anymore, just like what Dr. Shill said. And just, one other point, and I just want to warn everybody out there, because I've seen this in a couple of folks where, unfortunately, just because, people are desperate for looking for that cure or that panacea, that one thing that's going to fix everything, there are unscrupulous people out there who exploit this for their gain, so they've gone to like China or Mexico and things like that, and have had stem cells injected, whatnot. And I would really strongly discourage and dissuade people from doing, stuff like that, or at least talk to your a neurologist and your movement disorder specialist if you're thinking about something like that, and we may be able to, if at least stem cells is something you definitely want to do, then at least steer you in the right direction in terms of where there's actual legitimate research going on, rather than going somewhere and getting, spending thousands of dollars to get this. So I just wanted to make that point.
That's great. Thank you. We have a question here, and I'll just read it to you. My husband has trouble sleeping. Is he a candidate for research for this kind of issue? And then secondly, are there any studies we can do if we live outside of Phoenix that require very few trips? So that's kind of a two-faced question.
So,
So,
I mean, it depends. I mean, unfortunately, I can't give a real specific answer to that, because you said that her husband has difficulty with sleeping. So what kind of a sleep, it needs to be distilled down a little bit further, like what kind of a sleep problem is it? Because as I mentioned, if there's excessive daytime sleepiness and he's sleeping during the day, and because of which he's not able to sleep at night. So, there's a discrepancy in the sleep-wake cycle. Then, would kind of, but we would need more information than just that. So there's excessive daytime sleepiness, then he might qualify. I mean, we would consider discussing this further in the context of the study that I mentioned. And as far as living outside of Phoenix is concerned, the number of study visits and the how far they are spaced apart, that varies from a study to study. So I don't think that there's like one general formula that would apply. Just if I were to generalize, I could say that initially they are a little bit closer together, where maybe one or two visits a couple of weeks apart, or about a month apart, another visit and a visit after that, and then they tend to be spaced out a little bit more in the later stage of the study. In general, again, I can't speak for all studies, so
Add to that,
I think it has to be discussed in the context of a specific study.
thank you, Dr. Mehta. Dr. Shprecher, do you have anything to add to that?
Yeah, sort of for this people who travel from out of town and really want to limit to just one visit a year or less, one of the observational studies that I work together with Dr. Shill on is through the Michael J. Fox Foundation, called PPMI. And people can read about this just by using their favorite search engine, looking up PPMI, Michael J. Fox. It's a study trying to understand how people progress over time with different types of Parkinson's. Currently, we're enrolling people who have a gene that predisposes to Parkinson's, such as the GBA gene or the LRRK2 gene. The GBA gene is one that Dr. Mehta mentioned also may have a treatment study starting at Mayo. So if people are of Ashkenazi Jewish heritage, then they are more likely to carry this gene. Otherwise, it's only seen in about 5% or less of individuals with Parkinson's. You can go to the website and learn more about it, and if interested, can send in a saliva kit to get genetic testing after undergoing counseling by phone about what the test means. People who have the gene can come in once every year, or in some cases every 2 years, to Sun City, Arizona to participate in that study.
Okay, and then do you have anything to add regarding the person who said her husband has trouble sleeping and wondering if he might be a candidate for any research?
Yeah, I would say that sleep problems are important to, first of all, discuss with a neurologist, and preferably one with a lot of experience with Parkinson's, because there are a lot of different things that can contribute. In the cases of actual treatment studies, the main studies that we talked about are for people who act out their dreams. Here in Sun City, we're doing that study. And then for people who have excessive daytime sleepiness at Mayo.
Okay, thank you. And just want to remind everybody as we go through that, our website, www.pmdalliance.org, has a list of the research programs. So you can kind of go one-stop shopping in terms of finding out about those. The other thing that came up too was we had an individual who said, I live a distance from Phoenix and Tucson. Is it really important that I see a movement disorder specialist? My neurologist hasn't referred me to one. And it sounds like from what you said, Dr. Shprecher, that with sleep issues, there might be some real advantage in seeing someone who has a lot of patience and more expertise with movement disorders and Parkinson's in particular.
Yeah, I mean, we're all, biased by our experience, but from what I think we can all attest to is when we see someone who has not been followed by a movement disorder specialist, there's usually a lot we can add, not just for the movement disorder medication adjustments, but also addressing all of these other symptoms that are related to Parkinson's, but don't necessarily respond to the movement medications, require other treatments. So even if it's a once a year visit to get consultation advice, it can be valuable. There are also some cities where some groups are offering telemedicine visits, for example, in Flagstaff and in Cottonwood.
Thank you, thank you. One of the things that comes to mind too that we haven't addressed and is a question was asking about the benefits of exercise. If there have been any studies done regarding therapies and exercise as and the outcomes from studies like that. I know all three of you are advocates for that, and offering different exercise programs. Do you have any comments on that? Maybe Dr. Shill?
Yeah, I certainly would be happy to comment on that. So first of all, exercise has been studied a great deal in Parkinson's disease, and it almost seems like no matter what you study, it is efficacious. So, and what we're finding is that it needs to be at least moderate intensity exercise, at least 3 to 4 times a week. So, and that all, and can certainly make an impact on Parkinson's. So, so those are exercise classes sort of in a controlled setting where you assign people to a person to do the training, and they're followed very closely with rating scales and all that type of thing. So one of the things we were actually interested in when we started to study about 4 years ago was whether just kind of the wellness classes that are available out there, is there some evidence that those actually make a difference in people? And so this was when I was working out in Sun City with Melinda Theobald there, who does the wellness classes out there. And we specifically looked, all we kind of looked at is just does regular attendance in wellness classes actually make a difference on how people do? And it surprised them, it actually did. So these were people who were kind of newly diagnosed in the first couple of years of diagnosis, who thought they were doing a good job exercising. And we said, hey, come try out our program, come come to do the Parkinson's specific exercises and see what you think. So, and people invariably improved. Their quality of life remained stable. Their fatigue levels improved significantly. All of the measures that we did related to kind of gait and balance and their walking ability improved significantly. And furthermore, everybody made new friends and had good colleagues that they could carry on with. So, and we followed these people out over an 18-month period of time and showed actually these benefits persisted. So, so long and short is exercise is good, and actually there's quite a bit of evidence now, research-wise, to say that it's good. And furthermore, the wellness programs that are available within Arizona, Phoenix in particular, and Tucson in particular, with Becky Farley's gym down there, as well as the programs up in Flagstaff, there are really quite a large number of options for wellness programs.
Thank you, thank you. Well, it's time to kind of wrap it up. I want to thank all of you three so much, Dr. Shprecher, Dr. Mehta, Dr. Shill, and also tell everybody that on the questions that may not have been answered, we will put those questions and answers in our next newsletter. So I'm assuming you all are on our notice and get our notices, because that's how you probably found out about this event. But we will go ahead and answer those questions for you at that time. But before we say goodbye to our doctors, I wanted to ask each of you if there is one thing that you would like to say before we all sign off regarding either this conversation or a message to people with PD, what would you say? So I'll start with Dr. Shprecher.
Yeah, I mean, most important message I would give is that with the right combination of treatments, both medications and physical therapy options, many people can have a very good quality of life for a long period of time, despite their diagnosis of Parkinson's. So really, if you're not responding to your therapy and you're not seeing a specialist, it's still worth trying to do so.
Thank you. How about you, Dr. Mehta?
I agree with what Dr. Shprecher said, that I think, and that there's definitely more reason now than ever before to be hopeful and optimistic, even though you have, been diagnosed with Parkinson's disease, because, that there's so much research going on that the future is definitely very promising. And, as I said before, I really strongly encourage everybody to seek out, whatever research avenues that may be open to them, and, participating in any study that they may be eligible for, because that's how we're going to move the field forward. And I think one day, hopefully, get a cure. So, and also, can I take this opportunity to put in a small plug for just a patient event that we are doing on April 15th here at Mayo Clinic at the hospital. So it's right off of 101. It's just a patient symposium. So, and it's obviously free. So please come in, join us, where we'll talk a little bit more about where all of the Mayo doctors and therapists, so our allied health folks, are going to talk about Parkinson's disease. Thank you.
Thank you for that. And in fact, we're getting people registering for that. I'm sure we're going to have a large group of people for that event. So we're glad to be a part of that. Dr. Shill, what are your parting comments?
My parting comments. So, I've been doing this almost 20 years, doing research, doing movement disorders and research in Parkinson's disease. So, and of course, I would have hoped to have had a cure by now. But what I think has been impressive over these 20 years is that we are continuing to learn new things. So, for instance, I would never have imagined when I finished training that we would be talking about things like vaccines for Parkinson's disease. I wouldn't even know. I mean, we didn't even know anything about alpha-synuclein back then. that it was this major protein in Parkinson's. And, here we are now starting to think about studies along those lines. So I guess just what I want to leave you with is that there just continues to be advancements in knowledge. And I think now is an exciting time with a tremendous interest in from the pharmaceutical world and all the people that are kind of sponsoring research with a large number of avenues that potentially might lead to a cure.
Well, thank you. And just to remind everyone, if you go to our website, www.pmdalliance.org, under resources, you'll find a list of movement disorder specialists. Our 3 doctors today are listed, as well as many others, and contact information for them. And that next month, we're going to be talking about the gut and Parkinson's. So the whole digestive process and all things related to it. So we invite everybody to attend again next time. And so in the final wrap up, I just want to thank all 3 of you, Dr. Shprecher, Dr. Mehta, Dr. Shill. Been wonderful having you with us. And thank you so much for sharing your time and expertise. It's definitely valuable experience for us. So have a good day, everyone. Thanks very much.
Thank you.
You too.